Okay. All right. Hello, everyone. Thank you for joining us today. Ooh, that's the wrong place to stand. I am very excited. We have Danielle Davis here with us today. She is the Director of Anatomical Services and the Body Donation Program at Ohio State. I will turn it on over to her.
Thank you. Thank you so much for this opportunity. I always enjoy speaking with different audiences and groups, and it's such an honor truly to be here. By way of introduction, again, my name is Danielle. I'm a licensed funeral director and embalmer for the last 15, 16 years, and I've been with Ohio State for just over 5 years. So as we go through, we'll certainly, I'm sure questions will come up. We'll do everything we can to make sure that those get addressed for you. So, for starters, you're probably wondering, what on earth is anatomical donation? We don't want to make any assumptions about what that means or what it all entails, especially because we have organ donation, and a lot of folks get those mixed up, and there's no shame in that. It's tough to keep all those different things straight, especially if you're not a doctor or in the medical field. So I'm just going to walk you through this chart so you can kind of see the differences and get a better understanding of what we do at Ohio State. So for anatomical donation or body donation, we work with the whole individual. So when a person passes away, they come to our program, and a lot of times our medical students, dental students, students of anatomy will study the body in its entirety. Organ donation, on the other hand, is kind of what you think about when you say someone needs a kidney transplant or someone needs a lung transplant. You're looking at just very individual parts of a person. As I mentioned, how is the donation used? Again, education is our primary mission. Majority of our donors will be future teachers, truly, or even a doctor's first patient is like what we like to say. Whereas, again, organ donation is more towards, again, transplantation, making sure that, if a person passes away, their legacy lives on by being able to contribute to another person to allow them to live. For criteria, body donation is a little bit more flexible, I guess you could say. So as you see here, no age limits. We've had donors who've reached 104. Bless their hearts. That's quite an accomplishment. No real restrictions on why an individual passes away. Very flexible, a lot of different options. Organ donation, on the other hand, is a little bit more strict, and that makes sense. They're looking to make sure that the person that passes doesn't have anything that could be then transferred to the person receiving. So they kind of have to be a little bit more strict, and that makes sense. And then in terms of registration, and this is something we get confused with an awful lot. So with our program, you actually have to submit some forms. We call them our enrollment forms or bequeathal forms. Say that word 10 times fast. That's not an easy one. And once that's on file, it stays on file. We just recently served a family whose loved one had been registered for 40 years. So for the last 40 years, this person was like, you know what, I want to go to Ohio State and I want to be that teacher. And that is such an honor, truly, for us. Organ donation, again, on the other hand, when you used to go to the BMV and they're like, do you want to be an organ donor? And you're like, I have no idea what that means, but sure, put it on there. That's what that refers to. So that's that little icon that would be on your driver's license or state identification card. Unfortunately, the two databases, so to speak, aren't linked in any way because they are separate programs. So we're trying to find a way to work around that, but it's not, you know how it is, all that bureaucracy and all that good stuff. So reasons for choosing donation. Why on earth would someone wake up one day and decide, hey, This is what I want to do. One of them is medical professionals giving back. Many of our donors have been doctors, nurses, dentists who, when they went through their program, worked with anatomical donors. And they want to find a way to give back in really a truly unique way. They see that there's a lot of value in doing that and giving back. There's also, in some cases, we've had individuals who are like, you know what, I have a really unique condition, and I would like to be able to teach or have someone learn from that. Relatively recently, we had a donor who, you know how your heart's on the left side and everything else is kind of where it needs to be? This person, their organs inside were flipped. So their heart was on the right side, and everything else kind of in the same, but you get the idea. So that was quite a tremendous teaching opportunity for our students. But even still, our donors are so unique in life and in death. We come across things that maybe there's an artery or some sort of blood vessel that looks a little bit different than the norm. And that's always a great opportunity for our students to be like, wow, that's different, and how might that affect the bodily functions and things like that. Oh, goodness. Financial savings. So I'm a reformed funeral director. I can pick on that. Funerals are expensive, like really expensive. At least $10,000 for burial by the time you have your services, you go to the cemetery, anything related. Now, I say that kind of tongue-in-cheek because having a service is so important for families and the grieving process. And I would never, if they want to do that, I am in 100% full support. But it is realistically expensive. Same thing with cremation, even. On average, when I looked it up across the United States, about $200 or $2,500 or so for cremation itself. So again, when you look at donation, we cover everything. We cover picking up the person from where they pass away, day or night, doesn't matter, we're always available, as well as the cremation once everything has been completed, and returning the cremated remains to the family if they so choose. So out of pocket, the only expenses for the families, copy of a death certificate if they need it. Obituary if they want to publish it in the newspaper, not even required. Nowadays with social media, you can post it on there for free and save. They're very expensive if you haven't submitted one before. Feeling useful in death. I hear a lot of times that, well, I've passed away, what am I going to do with this? Maybe someone can benefit. And that's a very valid thing to consider. And, again, regardless of why, ultimately, you are still being useful. Oops. A family affair. We have had, in the 5 years that I've been there, and I'm sure prior to me coming here, many generations of donating. We'll have folks that say, you know what, Mom did this, the process was super easy, I felt really comfortable and taken care of, and she was helping somebody, so I want to do that too. And that's really great, because having that generational impact just really goes really far. And then last but not least, I don't know if any of you here are Buckeye fans. I'm a Badger, don't tell my employer. And I know we got our rear ends whooped last week, but that's okay. But for many folks, we'll hear, you know what, I never got to go to college, but I'm a Buckeye fan. And I want to be a Buckeye, I want to be part of this community. And that is so true. And we celebrate that every chance we get, because we know how important this community is to folks. Again, I always rib on it because I have to, but I do support. So you must be thinking, okay, well then why choose Ohio State? just like why choose a certain funeral home, there are other options for body donation across the state. We've got Toledo, Wright State, Cincinnati. Of course, geographically, you're closest to us, but we still have a few aces up our sleeves, so to speak. We cover the entire state of Ohio. So let's say you pass away on the Ohio-West Virginia border. We're still able to assist you and your family. Some programs other than ours in the state don't have that ability to do that. That's their choice, that's fine, but we do like to mention it because it does set us apart. Again, no fees to the family. Some programs will have, you have to pay for X or Y or Z, and they're upfront with that. There are no hidden fees or things like that. But again, we make sure that we're covering everything, that transportation, bringing you here, cremation, return of the cremated remains, all inclusive, so to speak. We also have the option, as I mentioned earlier, that we can either return the cremated remains to family, or we have a mausoleum space where we can inter them, and they'll be, there as well. So again, that's a really unique option for us because not every program has that ability. Our criteria for donation, which will go on in a slide coming up here, is also, again, relatively flexible. We have that flexibility to make some adjustments, kind of tweaks here and there, whereas other programs maybe are very hard and fast in their rules. And again, no shade, as the young kids would say, towards those programs at all. Next of kin donations. So as I mentioned earlier, most of our donors will sign up ahead of time. They want their family to know that, hey, this is my wish, this is what I want to do after I pass. Sometimes folks don't get the paperwork in on time, God forbid. They pass away and the family's not prepared. We're able to then still accept those individuals after they've passed and still honor those wishes, which again is a unique feature of our program. And then you've got me, yours truly. Not every program has a licensed funeral director or embalmer on staff. That's not a requirement in the state. If you look it up in the revised code, it's going to say, nope, doesn't need that certification. But we are very proud of me being in this position, being able to share with families my experiences as a funeral director, but also working in this field now for about 5 years. Oh, goodness. So this is going to be a lot of text and gobbledygook, but I just want to kind of briefly help folks understand the difference between pre-registering, registering ahead of time, and registering after a person passes. So I'm going to pull all these up so I don't have to interrupt myself. Oh, goodness. Okay. So again, a lot of text. A lot of legal types terms, and I'll be happy to, afterward go over these things. But fundamentally, if you're planning ahead of time, you can submit the paperwork for yourself. You can announce your intention, or maybe you have some limitations and you have a healthcare power of attorney. They then are able to sign you up, or if you have a guardian, they're able to sign you up as well. And we have those forms available online because everybody has a website these days, but we can also mail the forms, fax the forms, whatever is going to be easiest for the donors or their healthcare power of attorney. And then once you register with us, we'll send you a letter with your enrollment number. And now we've got these fancy new membership cards. They're really... I laugh because I told my staff, I'm like, these look really sharp, and they're like, they're sharp edges? Oh boy. That really dated myself, I guess. So it's all right, we still love them. So who can register after death? So again, a little bit different. Obviously the person has passed, they're not able to sign things themselves, but just like when in the regular funeral industry, when someone passes, there's kind of a hierarchy of who can make arrangements. So in our case, the healthcare power of attorney can still fill that role. But if there isn't that, then a surviving spouse. If no spouse, goes to the children, so on and so forth. These forms are a little bit different. The language is a little bit different. But, we make sure that we're able to get that processed and have the donor brought into our care. So much words, gosh darn. But it's important that we talk about some of the potentially disqualifying factors for when a person passes away. And we get asked a lot of time, well, why do we have these rules? Why can't you just accept everyone? And we would love to. But we have to make sure that it's safe for our students, for our instructors, and for things like, for example, if an individual has MRSA, meaning it's something that's not able to be treated with antibiotics, or C. diff or meningitis, all of those things could be transferred to one of my staff. And it's an all-woman team, go girl power, and we just want to make sure that they're all safe. Same thing with extreme emaciation or extreme obesity. We have to keep in mind that when we're moving donors, once they're embalmed, not to go into too much detail, but that adds about 30 pounds of weight. So we have to keep that in mind when we're looking at, those upper limits. And then some other things, and again, not to get too technical, but things like fluid on the abdomen. Unfortunately, if your arms or legs are drawn up or in the fetal position, again, we need our donors to be able to lay flat so they're able to, again, teach to the best of their ability. Other things, no autopsy, no tissue donated. Again, we need the individual to be as whole as possible, so to speak. So, yes?
Well, almost everybody has had COVID-19.
Yes.
Does that mean your supply is very limited now?
So the question was, pretty much everybody's had COVID at this point. Does that mean that that's going to impact? So that's a great question. Now that we know more about it, that isn't a disqualifying factor per se. There may be some concerns if it's an active infection, but at the same time, like I said, we really try and weigh, we know more about the disease and how it transfers and such. So that's a little bit of a leftover but that's a that's a great question because, yep, I would be disqualified based on that and probably some other things. So that's all right. Oops. Yes.
How fresh does the body have to be?
Question was how fresh does the body have to be? So as long as we typically try and like to have the individual in our care within 8 hours. So if a person would pass, I always say, like an independent living, assisted living, if the family still wants to come and spend some time, certainly want that to happen. But anytime after that, as soon as you pass, your body starts to break down, sadly. It's pretty instantaneous. So we try and move as quickly as we can.
You die on a trip that you went on.
Yep.
You might put it in a bag, but you might not get offloaded for a while.
In those cases, God forbid, if you are on a trip and you pass, you would likely be put in what we call cold storage, essentially refrigeration. So, yes.
You mentioned that you have to pass away in the hospital or donate my body.
Great question. So the question was, do you have to pass away in a hospital to donate? Not for our program. For organ donation, you do, because they need to keep you on life support, need to keep your circulation going, your heart pumping, so on and so forth. But for our donors, we've had folks pass away at their homes, in a nursing home, a hospice care center, all of those things are just fine. Yeah. Great questions. Yeah. Question was, what about cancer? Cancer is just fine. Yep. No disqualifiers on that. We're just, again, concerned about things that may be able to transfer to someone. Yeah.
What happens if you choose to do this and get registered, but then when you pass away, you're not acceptable?
Gotcha. She had asked about, you've got your arrangements in place, you enroll, you want to be a donor, And then unfortunately, you have one of those conditions. That's why we always tell our folks, make sure you have a backup plan. I try my darndest, much to my staff's chagrin, to accept everyone that we can, especially folks who have pre-registered. You've shown your intent, and I want to honor that. But sometimes we have to say, you know what, unfortunately, we just can't move forward, so the family will have to choose a funeral home. Yeah. Great questions. And now you're going to get some more, so whether you like it or not. Frequently asked questions, the first being, let's say mom passes away from a very rare type of cancer. Are you able to study that? Unfortunately, because our students are just starting in their journeys to be doctors, dentists, so on and so forth, they're not able to determine essentially a cause of death or what that specific is. Now, if we happen to have a physician that we're working with and is like, hey, we have this opportunity, again, we always try and make that happen, but in general, we're not able to. Can someone be an organ donor and a whole body donor? This is something that I've really been kind of bending the rules a little bit. So when I started, it was a hard and fast. If you donated anything, couldn't be an organ donor. Don't tell my bosses, but I'm changing this around too. So we're trying to look at that and say, okay, maybe if they just donated a kidney, would we still be able to study that individual? Would they still be able to fulfill those wishes? It's not a hard and fast rule anymore. So really trying to make that happen. But generally speaking, if a person wants to donate their organs to help another person live, we are 100% behind that. We want you to be able to do that. Sometimes, like I said, you just can't do both, but we certainly try. Does a funeral home need to be involved? So back in the day, our program started in 1959, give or take. And, being brand new to all of this, they're like, we need to have a funeral home or, someone else involved who knows what they're doing. So it used to be that, yes, a funeral home would have to do transport and help with death certificates, things like that. But now, with our expansion of our program and having me as a licensed director, we're able to take care of all of that. We don't have to contact a funeral home. The family doesn't need to make that call and then have that expense. Because funeral homes, they're going to want their money, unfortunately, too, and rightfully so, but if we can cut out that middleman, we certainly do. And again, death certificate, we can help with that. Obituary, I've written many in my days, so we certainly, again, just want to assist in any way we can. Can a donor's family have a funeral service before donation? This one is a tough for me. Again, Reformed funeral director. Given our program and the preparations that would need to be done for a viewing, namely embalming, we can't do both. What I do encourage families, though, is if they want to have a few private moments with immediate family, to make that call to the funeral home to say, hey, can you just do some very basic, minimal preparations so we can have that time? And we certainly do all we can to accommodate that. Because again, want to be able to have families have that experience, that chance to say goodbye. Do we hold any type of service? We do. Great question. Every year, we have a memorial service for all of our donors. We get presently about 250 donations a year, and during that program, we'll read their names, we'll provide a small gift to the family, and I'm not gonna lie, I cry every time. You think I'd be better about that by now, but it is a very moving tribute. And having all these donor families together, who are all going through that same experience, a very unique experience, I might add, is very powerful. Do we pay people for donations? I get that question frequently. Unfortunately, no. The law says I can't do that. But again, we're kind of paying in a way in the sense that we're covering all the expenses related. So yeah, I think we've talked about that, but I'm happy to answer any questions further. Yes. Oh, goodness. Yeah, well, certainly. Well, I'm sorry, could you repeat the question?
Wondered if the family that would be donating the body, would that be a tax situation?
Question was about, is it a tax? Are you able to deduct it from your taxes if you donate? And that is a really good question, one that I have never thought about, but that is very enterprising. No. That's like I said, great question. To the best of my knowledge, that is not an option. It would be great if it was, because that'd be further incentive. We do on occasion, we'll get like insurance companies asking for some sort of indication or proof essentially that a family has donated, but I've not run across the tax one before. Now I'm gonna go home and think about that. I'm laying in bed thinking about whether I can somehow, very good. So this last slide is just kind of a really just a testament to what our program does. Again, we have medical students who are so moved by this. They're thinking, oh my goodness, I have an opportunity to really make an impact. So when you think about it, it's, let's say a doctor goes through our program, and that doctor works for 40, 50 years. All the different patients that result from that doctor going through the process of working with their first patient. Again, maybe a little bit of a stretch, maybe a little bit of a wishful thinking, but I know for a fact that our donors have a lasting impact. And I know that every donor that comes through our doors, my only regret is that I didn't get to know them in life, that I don't get to know their families, I don't get to hear those stories, get that history, but the respect that I show, my staff show, everyone in the program shows, is just really truly a testament to how important and how serious we take this. So my contact information here, and I've got some handouts over there as well. I always say I try to be as transparent as possible without, maybe sharing too much. But so please, questions. Yes.
So you're in an automobile accident, your body's in great shape.
Yeah.
Driver's license says organ donation. I mean,
How does
you've
that?
done this, but you filled out this form.
Yeah. So she asked, let's say you're in great shape, you have an automobile accident, God forbid, and you've signed up with us, also signed up to be an organ donor. It's another tricky one, gosh. Okay, so in the realm of all of this stuff, I guess, I'm not even sure what to say. If a person has an accident, an automobile accident, God forbid a homicide, God forbid a suicide, they will in all likelihood go to the coroner to have that autopsy. They're going to need to determine exactly why a person passed away. Now, things have kind of changed in that regard. It's kind of up to the coroner if they want to. So let's say, car accident, okay, we know what happened. They go to the hospital, they're on life support. Then the family will be approached and they'll say, hey, do you want to donate, their organs? Again, we want to encourage that because if another living person can continue to live, we want to support that. Organ donation, declines for whatever reason, and then we would step in. So lots of kind of like a decision tree of all the different ways it can go. And it can get complicated, and we can't forget about the emotions that are wrapped up in this, because there is a lot. We actually had a family who organ donation wanted the family to donate his kidneys, and the family was adamant that no, they wanted to come to us. And so, again, we're trying to balance all of these, the personal wishes, the wishes of the organ donation company, organization. So it is a very sensitive, but again, we try and support in any way we can. Oh, good. The woman in front with the colorful shirt first, and we'll get you next.
When the body is donated, it's not embalmed, so when they work on it, is the body frozen?
God, you guys, good questions. I think you did your research or something. Okay, good for you.
So I have donated, I do have a form, I'm donating my blood to OSU.
Perfect.
Now I continue to get requests for donations, going down on your mailing.
Oh, jeepers. Oh, boy.
Wondering what's gonna happen.
100%. So she had asked, okay, if you're not able to be embalmed when you come to our program, are you frozen? How do students work on the individuals? So a majority of our donors, when they come in, we do embalm them, but we have kind of a special, secret, super fancy, not really, but you get the drift. Though our concoction, so to speak, is really designed to preserve for multiple years. Whereas a funeral home, when they embalm, they're just trying to, maybe a week. Not to say that the individual will decompose at a faster rate and so on and so forth, but our intent is really to make sure that we can make the most out of our donations. We do have some programs, some of our surgeons who prefer to not have them embalmed, so we have that option as well. Yeah, you certainly, yes.
So I have two questions.
Oh, gosh, okay, no, I'm just teasing.
My first question is, after medical and nursing students are done with the body, there is an to cremate.
Wonderful questions. Gosh, guys. So she had asked medical students finish up their dissection. They've studied the donor to a point that we've learned everything that we can. Is there anything left for cremation? Yes. So again, not to get too graphic, but any tissue or anything that would be temporarily removed from the individual, we keep. And so everything goes back to that cremation and returned to the family. That's something that is super, super important because I'm sure you hear things on the news and all sorts of horror stories. Again, that's just, for us, it's a no-brainer. It's respecting the donor. It's being respectful of the donation and the gravity of what they decided to do. So long story short, yes, we return everything to the family. And then you had a second question? Okay, well, just put you on hold. Okay, sounds good. Yes.
I thought that you cremated what was left.
Correct. So when I say return, or when they're completed with their studies, we take everything, anything like any tissue that may have been removed to further reflect or look at something, all of that is cremated, and then all of that is returned to the family. Yeah.
There is an organization, or there used to be, here in Ohio, and this in many other states, where they would make arrangements in advance for you and carry out those advance directions. It was something you donated like $50 to join. Have you heard of anything like that?
So he asked, was there any type of like organization that would essentially help you through the process, take care of everything for a fee? I do know that initially when our program started, I think there was like an enrollment fee of maybe $50, so kind of something similar, but I'm not sure. I'd have to get back to you on that one, so, yeah. You got, oh. Let me grab her so she remembered, okay.
Most of us are in our 70s, 80s, 90s. Some of us are 100.
Sure, yeah.
So are our bodies really candidates
She asked, with the population of your peers, realistically, are your organs going to be viable for donation, for transplantation, I should say? Unfortunately, no. It's really tough because we want people to sign up for organ donation, we want them to, but the reality of it is as we age, things break down, and it may just not work. So, yeah, unfortunately. Yes, yes.
Someone mentioned something which, of course, fell right into my lap, which is proselytize for the Funeral Consumers of Alliance.
Yes, yes.
That's the national organization, to find it online, but there is this fabulous local organization, and we have had speakers, and I'm sure Ava will have them again, who know everything, death, funeral, preparation, pre, post, and with wonderful speakers, and also, if you join, you can utilize their central Ohio.
Okay.
There are 2 funeral companies in the area that subscribe to this, and we use them. I've used them 3 times now.
Good, good.
Excellent.
Good. So she was commenting how there's a National Consumer Funeral Alliance. Did I get that right?
Funeral Consumers Alliance of Central Ohio.
Oh, boy.
FCACO.
Funeral Consumers Alliance of Central Ohio. I think I got it. What she's referring to is an organization, part of a larger organization, that really tries to pull the curtain back on the funeral industry. I would love to say that funeral homes are all above board, do everything by the book. Unfortunately, we know that's not the case. So what this organization does is empowers people to be consumers, smart consumers. Strange to think about it that way. Usually, you've been going to the same funeral home for 20 years, and this is just always what you've done. But this alliance really tries to help you to ask questions. Is this the best fit? What are their practices? Are they being transparent with their prices? And I know when I was working in the funeral industry, it felt weird to have people call and be like, what's your price for cremation? What? What? We're gonna do this over the phone? But that's the reality of being a smart consumer. So.
And those price lists they have to be given to you.
Correct.
By a funeral home. And they're hard to interpret. The Funeral Consumers Alliance does interpret some of them, select ones that but by the way, they're also great advocates of organ donation.
Great.
The Ohio State program.
Wonderful, wonderful. She was just saying about how it is according to the Federal Trade Commission that when you walk into a funeral home and you say, I want to ask about a price of cremation, they are required to give you a price list before they say anything at all. FTC will go around and test people, and there is a very, very large fine if you do not produce that price list. Again, trying to ensure transparency. Her comment also was that these price lists aren't always easy to decipher. And that, again, is very frustrating because you want your consumers to be informed and have it be easy. But there are resources out there to help you. Yours truly is always happy to assist, like I said, in any way I can. Yes?
What if you signed up with an organization like yours from another state? Right?
Gotcha. What if you signed up to be a body donation in another state? So, for better or worse, registrations don't go across state lines. We don't have any sort of national database that says, oh, you registered in Ohio and that'll, apply in Florida. So in that case, you can register, if you wanted to, you could register in all 50 states. No. Yep, because realistically, if you are signed up with our program and maybe your family is like, you know what, I don't want to do this, for better or for worse, and they don't call us, we don't know. So it is not like a binding contract that you sign up with us, you have to come to us. Or maybe you sign up 10 years down the road, you're like, this isn't for me, just give us a call, we take you off. It's not, there's nothing punitive at all, so. Any other, yes?
For the medical school,
Mm-hmm.
how damaged can a body be? In my case, I have a damaged body.
Oh my goodness, I'm so sorry.
Well, I fell down the stairs.
Oh, well, I'm glad. Oh goodness. The poor woman here has fallen, had a fall down the stairs and injured her spine, and she's asking if you're damaged, can you still donate? Short answer, yes. Long answer is that as our population lives longer, hip replacements, knee replacements, cervical fusion, where your vertebrae are fused together, we've seen just about everything. And all of those things are just fine. Yeah. Yep. It's another teaching opportunity. So, yes.
You mentioned something about refrigeration.
Yes. Yeah.
Yeah, and since the limitation is the state of Ohio, if someone dies outside the state of Ohio, could there other people with them say, well, I want this body refrigerated and shipped to a university, and you would still take it?
Yes. So she asked, what if you...
Not be cheap, I'm sure.
Correct. You've anticipated my commentary. So what happens if you pass away in Michigan? Indiana. We'll say Indiana. We'll not hate on them. What happens then? Can you still donate? So again, a little bit of a trick question, but that's all right. If we look strictly at our requirements, so to speak, we say you have to be in the state of Ohio, only because I'm only licensed in Ohio, so I can't do the paperwork, and I can't do the death certificates, all that good stuff. But within the last couple of years, we had a gentleman living in Chicago, and he was insistent that he came to be a Buckeye with us. So he worked with a funeral home in Chicago. Once he passed, put him in cold storage. They did all the paperwork and transported him all the way here. So it's just at the family's expense then. So again, we try and honor as much as we can. We're not making a profit. Again, can't pay for donations. So we have to be a little bit fiscally responsible on those things. So yeah. Yes. Oh no, yep.
Do you have any successful stories as to what your organization has found in doing some of these?
Oh my goodness. Any success stories from what we've found? That's another one that I'd have to think about a little. I do know that we've had different, I say abnormalities, but it's not a bad thing, just differences, aberrations, that have been of interest to our anatomists. There was one relatively recent, I think it was called a horseshoe kidney, and it was how the kidneys had formed. And again, it was something that was congenital, something that the person was born with. So again, we're not able to do that pathology. We're not able to study per se, but you'd be amazed at all the different things that people may live their entire life and not know that. Well, I think the guy that had his heart on the wrong side probably knew, but that's a pretty big one. But yeah, that's the one that comes to mind. So,
Worthwhile.
100%, because think about it. You go to your doctor, and you're saying your arm hurts, and they're like, "Well, I don't know what that bone's called." Oh, good grief, that's kind of concerning. So the time they spend with us really gives them an opportunity that a book doesn't give them, virtual reality doesn't give them. It's hands-on. It is the best possible education, certainly. Yeah.
So how long are you able to keep a body for use? I mean, what's the typical time period?
certainly. Most of our donors are in the program for up to 2 years, and that gives us ample time to study with that individual, to learn from that individual. With that said, on occasion, we have a donor who says, you know what, I want to teach as long as possible, as long as I'm useful. We have a woman that I think has been with us for 30 years. Yeah. So, I mean, that to me is such a selfless and such an amazing gift. And think about how many people have learned from her over the years is incredible. I'll get you after I get, yes?
I'm just a little confused, John. Okay, so you use the body for research and so on. What about cremation? So if the family wants to have a funeral, fairly soon, that's a question I have. And the second question is, do you share information with the CDC internationally and nationally?
Okay, I'll start with the easy one first. Do we share things that we find with CDC or other programs? Because of our criteria, we don't necessarily run across a lot of those type of cases. The one exception would be if someone would have the human version of mad cow disease. That's a biggie. That's a big one that we would have to report. But again, in all likelihood, they wouldn't even make it into the program, given our. Now during COVID, there was a lot of. We did COVID test all of our donors that came in post-mortem, and again, it's that fine line of, do we share that with families? HIPAA violations. Ultimately we did with the health department's recommendation. But yeah, that's not typically. And now I forgot your first question. I'm so sorry.
When you have the body and the family.
Oh, yes, the service.
Cremation
Yes,
service.
yes.
I guess I'm confused of how long that takes. They might want to have a funeral fairly soon.
Right. So she's asking, okay, so if it's, you could potentially have the individual with you for 2 years, family wants to have that service. Family wants to be able to move forward. And that honestly is a real challenge. As a funeral director, again, I want people to have that community to get together to share in their grief. Sometimes what families will do is, rather than have the cremated remains present, they'll maybe put up a picture, or maybe dad was a golfer and bringing his golf clubs and some other memorabilia, things like that, to kind of stand in. With that said, though, let's say 2 years passes, family get their loved one back. It's kind of like tearing that Band-Aid off again. And that hurts my heart to no end, because that is not our intent. Our intent is always to make them, folks know how honored, how much we've benefited. But that's unfortunately, a trade-off, I guess you could say, with the program. So, yes.
I just have a comment.
Sure.
We have both donated a number of years ago.
Sure. Yeah.
And I, of course, wanted to let my primary care physician know that.
Mhm.
And she had a copy of it.
Yeah.
And when I did, she was absolutely ecstatic. She said, "You will never know how much I learned." So I would suggest that anyone who has a doubt about the program, talk to your primary care physician. Ask them what they think
Great
of
point.
the program. They'll be sold.
Wonderful. She said she had presented a copy of her enrollment paperwork to her primary care physician, and the physician was so grateful that she had chosen to do that, because they had learned. They wouldn't have been able to learn without folks who had donated their bodies. Again, not something you really think about, and we're also extremely fortunate at Ohio State that we have this program. Not every medical school has this option. So that's certainly, again, they within their means, within what they're able to do, but we're just so grateful that, folks like yourself see the value, because there is, I'm biased, but there is a lot of value in doing this, so. Any other, you guys knocked it out of the park. I actually had to use my brain this afternoon. I'm just teasing. Yes?
I guess I
donor card and my donation card in the same wallet.
He said, well, I guess I shouldn't carry, both my donation, for us as well as donation for organ. We get that a lot. And again, unfortunately, if you pass at a hospital, not sure if you know, but it is required that for every person, the organ donation organization is contacted, for better or for worse. But let's say you pass away at home, you're not going to have that same contact. So in all likelihood, then it would just automatically default to us. But I think it's still important to carry both because it's that documentation that this is what I want to do. I want to be able to give back. So, yeah. Anything else?
Have you ever been picketed by the Grave Robbers Association?
Have I been picketed by the Grave Robbers Association? Not in my time. That certainly would be an interesting, and to be perfectly frank, you may have heard about two guys called Burke and Hare, and they're the ones that kind of made it known that they were going to different cemeteries and exhuming, is the technical term, bodies from their graves and selling them to medical schools. Anatomical donation has gone back thousands of years. It's been around forever. In different forms and the legalities of how the individuals were procured. But no, to date, no picket lines, no harassment. I hope to keep it that way. I got enough on my plate, my goodness. Anything else? Well, again, I've got some, I was going to say goodies, but they're not really goodies, some handouts and whatnot. I'll also put out just some of my cards that are loose. So again, if you have questions, comments, concerns, suggestions for how to make our program better, we are open to all of those things. We want to make sure that we're serving you folks, we're serving the community, and serving the wonderful people that participate. So, thank you.